Hi, Dr. Gulani. So we just finished our day of surgery, had a number of patients with multiple impact factors, as you know, complications of LASIK, fixing dislocated lenses, did all of that, and some of the patients today had commonalities of uniqueness, which was involuntary eye movements, along with their multiple impact factors. Like one of the patients, and I'll show you the videos my team will post for you on social media, is this patient from Washington, D.C., Virginia area, who, besides having a posterior subcapsular cataract and a keratoconic cornea, high irregular astigmatism, and fuchs dystrophy, this patient also had very high nystagmoid movements, along with severe blepharo spasm and facial spasm going on continuously. Now, important thing is she elected not to go for any sedation, and as you know, majority, nearly 100% of my surgery is without anesthesia of any kind, including IV sedation. So I was okay with it, but how did I modify my technique? Keeping in mind that she's fully awake and I have to be very delicate, and that's an important point I'm teaching this weekend in the webinar for cataract surgeons, how delicate you have to be and how impactful. So what I did here is, besides the other factors that I was facing about her posterior subcapsular cataract, high astigmatism, protecting the cornea of the fuchs dystrophy, making sure she doesn't move, I use my second hand as an anchoring fulcrum, and then I work with one hand throughout, and yet gentle movements so the patient feels nothing. And you can see me in the video asking her throughout surgery, any pain, discomfort, and she keeps saying no. So that's very important, get the feedback from the patient. So what I did here is, when I go in with my second instrument on the left side, as I do, and I'm operating with this side, this hand with my right hand, with that same hand and movement, as I keep teaching you, use it for every movement to be beneficial. Don't just stay there. Do not go in and out of the eye. Make it very efficient what you're doing. So with this instrument, I'm not only fixating the eye in a tight paracentesis so it doesn't move, and my incision is holding this instrument. I'm also using that to open up the iris as I go while I'm doing horexis. Second, I'm also using that to crack my nucleus of the cataract. 3, I'm also using it in these high myopic patients to separate the iris from the lens diaphragm, because as you know, they go into posterior pupillary block that can deepen the chamber, give the patient a sudden feel of pressure. And also at the same time, I'm using that same instrument to check my placement of the toric lens implant while I'm there. So while this instrument's main job is to maintain the eye not to move anywhere and yet be delicate in a dance that you do with both hands, it's also important that I use it for all the 4 functions I just mentioned to you. And again, we come out sutureless, and I've shown you the immediate video of this patient where she's explaining how comfortable she was and how thrilled she was that she could get this kind of surgery. And by the way, she was 20-25, unaided on measurement immediately post-op, and she gets to travel tomorrow after I see her post-op. Right, so show you the stuff today, and again, keep on rocking.